I just don't know how to talk to teens about drugs.
Adolescents don't listen. They just do what they want.
How do I talk about something I've never even tried and don't know much about?
It's my job to protect teens from drugs, whether they like it or not.
It seems like most teens use drugs. Can I really make a difference?
We understand. Many adults struggle to communicate effectively with youth about preventing and reducing substance use. While our protective instincts are good, we often rely on outdated messages like just say no and scare tactics, which can be ineffective and sometimes harmful. Today's youth need better. Hi, I'm Dr. Bonnie Halpern-Felsher. I'm a professor of pediatrics and adolescent medicine at Stanford University. I'm a developmental psychologist and the director of the Stanford Reach Lab. We study adolescent health-related decision-making and risk behavior and translate the research into transparent and effective drug education, prevention, and intervention. Together with the Stanford Center for Health Education, we've developed this short course, Becoming a Trusted Adult, Foundations for Effective Drug Education. It is well established that having evidence-based support for a caring, trusted adult is one of the most powerful elements for preventing and reducing adolescent substance use. Yet many adults struggle to connect with adolescents. In this course, we want to help you overcome common obstacles and learn communication skills for becoming a trusted adult. To this end, we've brought together young adults and experts in drug education, adolescent psychology, motivational interviewing, and middle and high school education. They will provide evidence-based strategies you can use to teach and empower young people to make safe and healthy choices during this important time of life. This can have a lasting impact on their health and well-being.
In this course, you'll learn how to develop a better understanding of who uses drugs and why, including the real and perceived risks and benefits of different substances, describe the risks of drug use during adolescence, recognize signs and symptoms of adolescent substance use, and use evidence-based, non-judgmental communication strategies to motivate change behavior and foster an open, trusting relationship.
Why is this important? During adolescence, young people before the age of 25 or so are at higher risk for developing substance-related dependence, substance use disorder, and a range of other short and long-term harms related to their use. To protect against these harms, we must have a good understanding of adolescent substance use and communicate in a way that builds trust, respect, and collaboration, without blame and shame, while providing accurate information framed for how adolescents, not adults, make decisions. The reality is that youth will make their own choices, and that's a good thing. We want them to enter adulthood equipped with the knowledge and critical thinking skills to lead a safe and healthy life.
Who is this course for? This course is for adults, including educators, school counselors, school staff, parents, caregivers, and family members who interact with middle and high school age young people around the ages of 11 or 13 until 18 or 19. Whether your relationship is extensive or limited, understanding and applying these concepts can be beneficial.
What is a drug? We use the terms drug and substance interchangeably to mean any substance that in small amounts produces significant changes in the brain, body, or both. This includes alcohol, tobacco, nicotine, cannabis, LSD, mushrooms, and fentanyl. These are all drugs. We are not saying that all drugs are the same. In fact, we hope that you will gain a more nuanced understanding of how various drugs affect the body differently. This is important in understanding why a young person may use that drug and in identifying strategies to prevent and reduce potential harms.
A harm reduction approach. In this course, we do discuss harm reduction. Let me explain what that means. A harm reduction approach to drug education discourages young people from using drugs, but offers more than a just say no approach. Instead, harm reduction provides teenagers with information to keep themselves and others safer if and when they encounter substances. Harm reduction does see non-use as an important and primary strategy in reducing drug harms. Clearly, the best way to reduce harm from drugs is not to use them at all. Harm reduction does empower teens to make healthier choices through accurate information. And it does recognize that some teens will try drugs. Harm reduction encourages teens to take steps to reduce the potential harms of drug use. Harm reduction does not encourage or condone teen drug use. Harm reduction does not teach teens how to use drugs and does not judge teens who do use drugs. We hope this course gives you the insights and strategies you need to have meaningful conversations about substance use with the young people in your life. Instead of lecturing or confronting them, we want to help you create a dialogue that builds trust and understanding. This way, you can empower them to make healthy choices. Thanks for joining us, and we look forward to supporting you on this important journey.